I am Dr. Woodson Scott Jones. I am the Vice Dean of Graduate Medical Education at the Long School of Medicine, UT Health San Antonio. We're really excited about this Social Determinants of Health orientation that we'll be providing to all of our incoming residents this year. It'll be the third year that we've done this, though we've had to do it virtually and not as completely as we've wanted to do it. So this year is going to be novel, but I don't know that anybody else has done something like this. It's an exciting opportunity with our partnership with Humana to put them through an experience that has been labeled as pandemonium. So we'll split them up, and half of them are going to go through a healthcare experience from the emergency room to the hospital to a well-integrated communicating healthcare network where there's great communication between the hospital and the pharmacy, from the hospital to the outpatient. Each of them knows what their needs are, how to communicate, and then to communicate and to link them up to resources. And yet we'll also have some of them go through what we often experience and see with our patients, a less integrated, not communicating system, or a system that's not recognizing what those social determinants are that are impacting their care. And they'll be sent back and forth between the different entities, whether it's their insurance or from the pharmacy back to the hospital, or from the food pantry saying, we can't help you until this gets worked out. And they'll experience the frustrations that, one, we often experience as providers trying to help our patients, and frankly, the patients do as well. What we hope that'll raise their sensitivity to the challenges that those they'll be caring for have. And then that'll be followed by some didactic time and education time where they'll be introduced to some of the social injustices and the racial injustices of our city. They go back to redlining in communities and zip codes where we still see significant poverty and barriers to our patients getting the care that they need. And then we'll see some great examples of hope, interaction, and caring from a physician who has taken their practice to the areas in the neighborhoods in our city that need help, has gone into those neighborhoods and said, how can I make a difference? How can I engage with this community? How can I help these patients? And is living it. And they get an example. And then they'll get a marvelous experience with our promotores who work with these patients and work in these neighborhoods. And we'll go and visit some areas of town where there's some remarkable things happening with education, with training to try to make a difference. And we want to keep that care alive within them.